Good afternoon. Rich Fitzgerald, County Executive here, giving our weekly update on the coronavirus pandemic, here with Dr. Deborah Bogan from the Allegheny County Health Department. And as we have remained in the green phase, we have continued in Allegheny County to see our numbers remain low. And we have seen no tests resulting yet from Election Day over 2 weeks ago, in which over 100,000 people voted, and we had a couple thousand people obviously working the polls, as well as the demonstrations that have occurred over the last number of weeks. So we're very fortunate in that regard. As we see, though, around the country, things aren't doing so well. And I really want to give a shout out to Governor Wolf and Secretary Levine, because we have seen 21 states around the country, almost half this country, in which cases are now going up again. The number of positive cases are going up. And in 3 states in particular, Florida, Texas, and Arizona, among those 21 states, are seeing a huge increase in the trends in new cases. Monday alone, Florida has recorded over 2,800 new cases that have occurred, and they're starting to talk about shutting things down again in Arizona, Texas, and in Florida. We certainly don't want to have that happen. In 9 other states, they have reported a new single-day high or set a record for 7-day new coronavirus cases. And those states are Alabama, Arizona, Florida, Nevada, North Carolina, Oklahoma, Oregon, South Carolina, and Texas. Just to put that in perspective, during the month of April, Pennsylvania, almost every single day of the 30 days of April, had over 1,000 cases per day tested. And some days we almost hit 2,000 cases. We never did go over 2,000, fortunately. The shutdown that Governor Wolf and Secretary Levine ordered has seen a great reduction. In the month of May, we only had 6 days over 1,000 cases positive, and 12 other days we had over 750. Thus far, in the 17 days of June, we have seen an average of 443 cases, none of which approached 750 or 1,000. So on a statewide basis, we have really done a very good job. And I think Secretary Levine and Governor Wolf in helping keeping us safe, in addition to all the folks in Pennsylvania who have followed the advice of our medical experts, is also good. According to the other thing, in the Centers for Disease, the CDC just did a headline, prevention proprietary data for states indicates that Pennsylvania is just one of 3 states that's had a downward trajectory of COVID-19 cases for more than 42 days. The other 2 states being Montana and Hawaii. So again, we want to thank the governor and the folks around the state, but also here in southwestern Pennsylvania. We have continued to see great levels of cooperation from individuals, from businesses, from people that are, again, listening to our medical experts. But we do not want to get complacent. There is still no vaccine. There is still no cure. So wearing the mask, being vigilant, particularly, you see sometimes in bars and other indoor facilities where people come together. We want to keep that physical distancing. We want to continue to keep wearing our masks, washing our hands, doing all the things we've learned over these last 3 months. So I just wanted to put in perspective some of the real success that we've been able to achieve here in the state, and obviously southwestern Pennsylvania and Allegheny County has been a big part of that as well. But we've got to continue to do it. 3 months isn't enough, we know, and again, we see what's happening in these other states. We're no different in that the virus doesn't treat Pennsylvanians any better than it treats Floridians. So we've got to continue to be vigilant. Otherwise, we'll be like some of these other states with some of these numbers. Now let me turn it over to Dr. Bogan to give an update on the medical front. Dr. Bogan?
Good afternoon, and thank you, Rich. As he said, our numbers are looking good here. Over the last week, we've had 79 new cases and 6 people have been hospitalized. And our test positivity rate has been between only 1% and 2% over the last 10 days. But we have to remember we are still at the beginning of this pandemic. Despite reporting no new cases today, people in our community are sick with COVID-19 and are being hospitalized, and some are dying. So today's report of no new cases does not reflect the real-time spread of the coronavirus in Allegheny County. It often takes 2 to 3 days for labs to report new positive cases. So today's report doesn't mean the pandemic is over or that we can relax physical distancing or masking recommendations. We still need to take steps to keep everyone safe. I've said this before, we've estimated that no more than 3% of the county has been exposed to coronavirus. That means that 97% of the population is still at risk and the virus has ample opportunity to spread. And we have no vaccine and no real treatment and certainly no cure. So we continue to watch our numbers closely and we ask questions when we see any deviations or increases. So for example, on Tuesday, we reported an increase of 27 cases. Our epidemiologist investigated this increase and found that more than 80% of these were in long-term care facilities, spread out over several days of testing. To get a better sense of how the virus is spreading in our community, we are embracing some changes from the CDC on who should be tested. Throughout this pandemic, the CDC has changed its guidance on who should be tested. At the beginning, testing was recommended only for people who were showing symptoms and had specific risk factors or worked in high-risk jobs. As testing capacity increased, the CDC recommended that anyone with symptoms, regardless of risk factors, should be tested. The CDC is currently recommending testing for people with symptoms, as well as those who are showing no symptoms but may have been recently exposed. These include people who are living with someone who has COVID-19, people who have been within 6 feet of someone with COVID-19 for 15 minutes or longer, or people who have been in large crowds like protests, marches, or rallies. So we are recommending here that anyone who may have been exposed to COVID-19 should get tested, whether you're showing symptoms or not. But you should be tested about a week after that potential exposure. Testing too soon can create false negative results. Some testing locations in Allegheny County are testing people without symptoms for COVID-19 if there is a risk of exposure or they're in a high-risk patient population. Sites allowing asymptomatic testing for COVID-19 in Allegheny County include select Rite Aid and MedExpress locations and our federally qualified health centers. And the health department is working with other testing sites to expand access to testing for asymptomatic individuals to be consistent with the latest CDC guidance. As we continue to open up, move around more, and interact with each other, it becomes increasingly important to know who may have the virus, symptoms or not. With people's focus on COVID-19 recently and the unprecedented measures we're all taking to slow the spread of the virus, I don't want people to lose sight of other health risks that can be prevented. Data show that children in Allegheny County are behind on their vaccinations. 2020 started great, with children getting their vaccines at rates equal to or above the 2019 rates. However, with the closures of our clinics and offices slowing down due to the spread of 19, we have seen a decline in our rates of vaccination. Compared to 2019, about 25% fewer children received their immunizations in March and about 35% in April. We saw a slight increase in May as offices started to reopen. I know that many children couldn't get their vaccines during these months because of the shutdown, but now that many healthcare clinics are open, it's really important to schedule those appointments for your children to get their vaccines, including vaccines against important and harmful childhood illnesses like chickenpox, measles, whooping cough, tetanus, and more. Keeping children safe means keeping up with their vaccinations. In addition to receiving vaccines through our many primary care providers across the county, vaccines are also available through the health department's Immunization Clinic in our Hartley Rose building in downtown, which is open from 9 a.m. to 4 p.m. Monday through Friday by appointment only. To make an appointment, please call 412-578-8062. The Ronald McDonald CareMobile Medical Clinic will also be providing vaccines and many other health services at stops across the county. A full calendar is available at the UPMC Children's Hospital of Pittsburgh website. And once this season's flu vaccination is available, we should all get vaccinated. It's very important. The better vaccinated our community is against influenza, the better we can manage COVID-19 in the fall. We're also reminding everyone that eligible pregnant and new mothers and young children can utilize services through the WIC, the Women, Infants, and Children program. WIC provides nutritious food, breastfeeding support, and education for mothers and infant formula and food for children 5 or younger who qualify. Our WIC clinics continue to conduct appointments over the telephone. The WIC offices will call you to complete the appointment and to instruct clients on how to receive their WIC benefits. Allegheny County Health Department is still accepting new WIC participants. You can complete a pre-application by visiting www.pawic.com or calling 412-350-5801. And finally, it's tick season. Please be careful if you're out enjoying parks around our county or just in your own backyard. Ticks carry the bacteria that causes Lyme disease and other disease-causing organisms that can be severe if they're not treated. To protect yourself from tick bites and Lyme disease, remember to use repellent that contains at least 20% DEET, wear light color clothing, walk in the center of trails and avoid wooded areas or areas with brush, high grass, and leaves. Conduct a full body tick check when you get home of yourself, your children, your pets, and take a bath or shower within 2 hours of coming inside. To close, I want to stress one more time, we are not through this pandemic. We're making good progress, but we're still in the early stages. The virus is still spreading and hundreds of thousands of us are still susceptible or at risk of the infection. If you look across the country and around the world, we're seeing increases as new cases in places that have opened too quickly. So it's important here that we follow all the green guidance and we follow our instructions, and that we continue to wash our hands frequently, cover coughs and sneezes with your elbow, not your hand, clean, frequently touch surfaces regularly, and wear your masks over both your nose and mouth. So please stay safe, have fun, and be kind. Thank you.
The first question that we have today is from WTAE. Do you have any thoughts on movie theaters reopening? Do you have advice for customers planning to attend or concern regarding the reopening?
So I have not read the reopening plans in depth, but movie theaters seem to be a relatively safe entertainment venue as long as people follow the green guidance, stay 6 feet apart, that they're separated in seating, that everything is cleaned appropriately, seats, surfaces, restrooms. I would recommend that people who go to the theater continue to wear their face masks whenever possible, including in the theater while watching the movie. Obviously to take them off briefly to eat or drink, but to leave them on at other times.
This question is from WESA. There are large protests going on for more than 2 weeks in Allegheny County. During demonstrations, hundreds of people are gathering, shouting, singing, chanting, and often touching, yet the number of new cases continues to decline. Why do you think people generally don't seem to be getting the coronavirus during these demonstrations, or is it too soon to tell?
Well, I think there's a couple things. First of all, it may be too soon to tell. There are still ongoing rallies and protests going on. But I think the good news is the protests are being held outdoors, which we know reduces the spread of the virus. People that I've seen have been mostly wearing masks, which is fantastic. And we have a relatively low rate in our community, and I think that's helping us as well. But people need to continue to be vigilant and to follow the guidance to wear masks, because in some of the protests, people are pretty close together. So we will continue to monitor that closely.
This next question is from Public Source. Are we testing enough to know how the virus is spreading in the community? And when do you anticipate the availability of mass testing?
I think first of all, I think we have plenty of capacity in our community for testing, and people who want to get tested generally can get testing if they want. And we now, again, have been changing our recommendations for people even without symptoms, but who may have had an exposure to get tested. We have seen a uptake in the number of tests we're doing in our community. For a couple of days now, we've seen about 1,000 tests a day, which is an increase. But I think generally demand isn't that high because we don't have a very high rate in our community. We have not had a mass testing site here. Instead, we've really tried to make sure there's widespread and availability of testing in as many of our communities as possible. But we continue to keep that as an option. If the pandemic were to change in our community and we would have a need for that, then we would we would put that in place. But right now, I don't think there's a need for a mass test site in our community.
This question is from WESA. Can we loosen other physical distancing requirements based on the lack of new cases we've seen?
I think I made it pretty clear in my comments that I would not recommend loosening our guidance at this time. I think the green guidance makes sense the green phase guidance makes sense for our community. I would like to see it continue that way because I don't want to be like places like Florida and Arizona that are seeing rapid increases in numbers here in Allegheny County.
This question is from a public source. On May 13th, the Wolf administration instructed county and municipal health organizations to be collecting sexual orientation, gender identity data, COVID-19 data from electronic health records. How is this data collection going, and when do you anticipate releasing that information?
So we are collecting that data during our case investigations and have been doing so even a little bit before the governor's guidance. And we have not released that information and don't have any immediate plans to do so. We're waiting to hear a little bit about what the state plans on doing, but also would like to do that in close consultation with the LGBTQA plus community here before we would make any decisions about that.
This question is from WESA. The number of COVID-19 cases at nursing homes has declined since May. Is it possible that a decline of cases within nursing homes is preventing people outside of these facilities from getting sick?
Well, we do know that residents in nursing homes are part of our community, and people go in and out of those nursing homes, particularly those who work there, and their loved ones have been kept out mostly, but again, we do have some exchange of people going in and out. So it certainly hasn't hurt our rates, but I can't say specifically if that's the reason we've been seeing a decline.
This question is from the Post-Gazette. Has the contact tracing team found any evidence that any cases over the last 2 weeks were the result of anyone attending any of the numerous protests outside of the county?
I am not aware that we've had any real bump in numbers from people attending protests or rallies.
This question is for both Dr. Bogan and County Executive Fitzgerald from WESA. Have you gotten your hair cut, gone to the dentist, or the gym since the county entered the green phase? And if not, when will you feel comfortable doing so?
Well, as you can tell from my long locks, no, I've not gotten my hair cut. However, I would feel safe going to any of the businesses that are following the green guidance. That is limiting the numbers of people going in at one time, wearing their masks, cleaning surfaces well. And so I think, again, I've been really impressed with the ingenuity of how businesses in our community have responded to the guidance. They have found really great ways to accommodate people and keep them safe. So yes, I've definitely been going into businesses. I do plan on going to the dentist soon. And as for gyms, I'm an outdoor exerciser. Rich, you want to answer that?
My turn, okay. I would feel comfortable, as Dr. Bogan said at this point, going to any of those facilities. I don't belong to a gym, unlike Dr. Bogan. I do most of my workouts either at home or out on some of our trails and biking outdoors. My haircuts, I've had 2 of them given by my wife over the last 3 months, but I would, now that we're in the green phase, the next time I am due, I will go to where I normally go. And I was also fortunate through coincidence that I had gone to the dentist for my regular checkup earlier in the year before the shutdown occurred. But again, I would feel no hesitance if need to go to that facility or any of the others, as you know, because I'm sure again they're going to follow the guidelines.
This question is from the Pittsburgh Business Times. Have there been any hitches or questions that others have regarding the return of offices and workplaces? Is there anything from a government or a health perspective that you would like employers to know about the return to work?
I really haven't heard of those type of concerns. I still notice that in downtown Pittsburgh and in some other areas, the foot traffic is certainly much less than it had been before. So I am assuming that many people are continuing to work at home, work remotely. I know a lot of the meetings that I continue to have governmentally are occurring on conference call or Zoom or Facebook Teams, etc. So these things, is just a way. I think a lot of companies and a lot of organizations are continuing to function, and I think that's going to remain that way as the governor and others have recommended. We still say stay at home if you can. We know we're in the green phase where people are going out, offices are open, retail, restaurants, etc. But I do think people are still taking a cautious approach because, as Dr. Bogan said, we're still in the early phases of a pandemic. There's no vaccine, there's no cure. We need to continue our physical distancing and staying away in enclosed areas, and that's really our best chance to not potentially have catch the virus.
This final question is from Pittsburgh. This final question is from Public Source. If people are asymptomatic spreading COVID, how are people to know whether they've been exposed? Or is it that anyone who has attended a rally or other event that they could have potentially been exposed at should be tested?
So people who are living with someone who has tested positive, in the past we didn't recommend those people get tested unless they develop symptoms, and now we're saying those people should get tested. The people who've attended rallies and protests and have been in close proximity to others, if they're worried or concerned, should get tested. Again, they should be tested at least 5 days or about a week after that potential exposure. Is that clear? Okay.
That was the final question. If either of you have closing remarks.
Yeah, but again, I want to thank everybody for their continued support and cooperation. As we've said many times, this is a marathon, not a sprint. So while we're a little over 3 months into when we started the shutdown, we still have a long way to go, and we still want to continue to cooperate and help our neighbors. So keeping physical distancing, wearing your mask. Wearing your mask isn't just for you. In fact, in many ways, it's really not for you. It's for everybody else that you come in contact with, whether it's in a room, whether you're outside, whatever function you're at. So we want to protect each other. We want to protect our families. We want to protect our community. So continue to be vigilant, continue to wear the mask, continue to physical distance, and let's continue to stay safe.